In this lesson, we're going to look at anxiety disorders and also mood disorders. We have 5 anxiety disorders to cover and 3 mood disorders. So the first one is generalized anxiety disorder, sometimes referred to as GAD. When you are excessively and persistently worried day after day after day, it can cause fatigue, irritability. They have problems falling asleep or staying asleep. They become restless. Other symptoms include muscle tension, upset stomach, short of breath. That's what SOB is, sweating. It is a very common anxiety disorder that involves chronic worrying and nervousness and tension every day. So people with generalized anxiety disorder, they worry about the same thing people without it worry about. For example, health issues, financial problems, family affairs, problems at work, etc. But they take these worries to a new level by blowing them out of proportion and worrying themselves until they cannot sleep or become sick. What makes GAD different from other forms of anxiety disorders is it's unlike a panic attack, because panic attack is fast. GAD is a 24/7 worry. They just cannot stop worrying about things. It has no real cause. It's unknown the cause for this worry, but everything causes them this doom and dread and stress in their life. So, please God, don't let the ceiling fall on my head would be something that they would worry about. They worry all day, constantly, about everything. People with panic disorders have sudden and repeated attacks of fear that last for several minutes. A person may also have a strong physical reaction during a panic attack. It basically feels like you're having a heart attack, pounding of the chest, your arm may become numb and short of breath. A lot of people go to the ER thinking they've had a heart attack, and when they rule out any heart damage, they realize, well, you just had a panic attack. Panic attacks can occur at any time, and many people with panic disorder worry about the possibility of having another attack. A person with panic disorder may become discouraged and feel ashamed because they cannot carry out normal routines like going to the grocery store or driving because they're so afraid the attack will come back. It can also interfere with school and work. Panic disorder often begins in the late teens or early adulthood. Women are more prone than men to have panic attacks. Not everyone who has a panic attack will develop panic disorder. People with panic disorder have sudden and repeated attacks, and they're very fearful. A feeling of being out of control during a panic attack, an intense worry about when the next attack will happen, a fear of avoiding public places because, again, they're afraid the panic attack will come back. Physical symptoms during an attack will, like I said, have the pounding or racing heart, sweating, breathing difficulties, weakness, dizziness, a hot or cold chill, tingling or numbing in the hands, chest pain, and also stomach pain. But it's acute. It's not chronic. It comes on fast and is brief. Another type of anxiety disorders are called phobias or phobic disorders. A phobia is an abnormal fear and avoidance of an everyday object or situation. Phobias are common. 8% of people are affected by a phobia. It's disabling and usually treated with behavior therapy, which we'll learn in an upcoming lesson. The patient most of the time knows that the fear is irrational, but they cannot control it. Therefore, it's a neurotic disorder, which all of these anxiety disorders are. Phobic anxiety disorders have the same common core symptoms as GAD, or generalized anxiety disorder, but these symptoms occur only in particular settings or objects. Phobic disorder involves unrealistic yet intense anxiety that is attached to external situations or stimuli. People who have a phobia avoid such situations or stimuli or endure them only with great distress. So phobias are like generalized anxiety disorders because of the many symptoms that are the same. The only difference that there is an external stimuli that is able to be identified and treated. So most people have a specified phobia, such as fear of heights or fear of spiders or fear of snakes. And one way to treat them is to expose them to their fears, hoping that the anxiety will decrease with that exposure. A lot of people fear these things, but the difference between the average person and someone with a phobia is that if you have a phobia, these things are always on your mind. Not just when you see a snake or spider, you become squeamish, but they worry about them all of the time. And may take precautions such as sweeping around the house for cobwebs and so forth in order to avoid any contact with a spider. There's also social phobias where one fears social settings, feels like they're ridiculed when they're out in public, and also agoraphobia. This is a fear of open spaces, basically fearing leaving your home in many cases. People have great anxiety if they try to leave the house. So another anxiety disorder is called obsessive compulsive disorder, or OCD. Now everyone double checks things sometimes. For example, you might double check to make sure your door is locked before you leave the house. But people with OCD feel the need to check things repeatedly, many times, or have certain thoughts that they cannot get rid of, these obsessive thoughts that they have to perform rituals or actions over and over again to get rid of those unwanted thoughts. The thoughts associated with OCD cause distress and get in the way of daily life. The frequent upsetting thoughts are called obsessions. To try and control the obsessions or unwanted thoughts, a person will feel an overwhelming urge to repeat certain actions or behaviors called compulsions. These are the rituals. People with OCD cannot control these obsessions or rituals or compulsions that go along with them. For many people, OCD starts during childhood or teen years. Most people are diagnosed around the age of 19. Symptoms of OCD may come and go and be better or worse at different times in one's life. People may have mild cases, and some people may have very severe cases. People with OCD generally have repeated thoughts or images about things such as fear of germs or dirt, intruders or violence, or being overly tidy or orderly. And then they have rituals that go along with these unwanted thoughts. So those who fear dirt and germs may wash their hands over and over and over again to get rid of those unwanted thoughts. But after they perform the ritual or compulsion, the unwanted thoughts come back. It's very cyclical. And so if someone's worried about safety, they may double check locks constantly, check smoke detectors multiple times a day. If they're worried about things being neat and order, they may straighten things up and have everything symmetrical. And this can really get in the way of one being able to perform normally on a daily basis. I'm going to ask you to stop the video at this point and look at the video that I have the link for. Here you can see a young mother with OCD. And finally, an anxiety disorder that many of you are probably familiar with is PTSD, post-traumatic stress syndrome. This is due to some traumatic event. So this is a lot of times people who have lived through some disaster, or a soldier in combat would be a good example. And what happens is they feel anxiety. They'll have like flashbacks where they go back into that traumatic event, that mindset. They can have nightmares as well. Now, mood disorders, they do not involve that feeling of distress and anxiety. They are characterized by a shift in your mood or how you're feeling, your emotions. So major depressive disorder is the first mood disorder. It occurs when signs of depression last 2 weeks or more and are not caused by drugs or medical condition. A few signs or symptoms of major depressive disorder include feeling fatigued or lethargic, feeling worthless, helpless, like life is hopeless, and their life has no meaning. Loss of interest is key. Loss of interest in family or friends, a diminished interest in doing things that one used to like doing. Major depressive disorder is fairly common and afflicts about 20% of the population worldwide. In every single culture across the globe, women are more prone to depression than men. Depression has a higher percentage in your late teen years and early adulthood years and tends to decline as you get older. The second mood disorder is called seasonal affective disorder, or SAD, and this is experiencing the symptoms of depression, but only in the winter months when we have a lack of sunlight. This is easily treated with light therapy. So the last mood disorder is bipolar disorder, which is formerly known as manic depressive disorder. This is a mood disorder where the affected person alternates between feelings of mania, where they become extremely hyperactive, and they also have periods of depression where they have little or no energy. Now, during the depressive state, one will experience symptoms just like I explained in the major depressive disorder. When they are in their manic state, this is referred to as the high in bipolar disorder, where the person is in an elevated mood. People in a manic state can become irrational and irritable, along with an increase in talking, and they have trouble sleeping. They can experience racing thoughts, slow attention spans, and become extremely hypersexual and engaging in other dangerous activities like spending sprees or gambling sprees. Along with this decreased need for sleep, sometimes getting less than 4 hours, manic people will have an inflated idea of their abilities and will become very impulsive. In some cases, extreme cases, they have hallucinations as well. The length of cycles vary from person to person. 20% of bipolar patients will experience rapid cycling, where they experience periods of mania and depression in a short period of time, sometimes within the same day. But to be a rapid cycler, one would experience at least 4 or more episodes of mania or depression within a several-month period. So some people will spend a good deal of time in a depressive state, and then they will go into that manic phase, and it's almost like they deplete themselves of all their energy, and then they go back into the depressive state.